Hi, I'm Dr. Jenna Shivers, and this is Miss Mindy Moo. Welcome back to the Lovely Vet. Thanks so much for tuning in today. We are here today to talk about insects and how they are involved in our cottaging and camping series. So insects are everything from our parasites like our fleas, ticks, mosquitos, which carry heartworm, as well as black flies, which can leave pretty nasty bites. So as always, we put the timestamps in, so if you just want to scroll through to a specific section, you can certainly do that. These different bugs, there's definitely so much that you can know about them. So just keeping in mind, we're just briefly going to go over a few different things. Number one, how to know if your dog has that bug, whether they've been bitten or whatnot. Number two, how to prevent that. And we're going to go over prevention actually first before we start everything. Number three, how to get rid of that bug. And number four, what types of diseases those bugs can transmit and what testing you potentially would need to do to make sure that your pet is safe. All right, let's get started. So starting with prevention, there's multiple different types of prevention for pets. There are certain spot-on types of medication that can work to prevent different ticks, fleas, and even have some repellent properties to mosquitoes and black flies. Those types of medications actually kill the tick before they actually latch on. So that's one huge benefit to them. They don't cover everything though. If you're using one of those medications, you also want to use a preventative for heartworms specifically, as well as for your intestinal parasites as well. So keeping that in mind. There are other medications that are a monthly oral chew that cover everything that you would need, at least in our area here in Ontario, Canada, that you can use on a monthly basis. For the most part, in Ontario, we want to use prevention for heartworm from June 1st to November 1st. So 6 months of the year, we want to use a monthly prevention. The tick season is longer than the heartworm season. So oftentimes, depending on your area, some areas are worse than others as far as warm climates. So southern Ontario, kind of the Niagara region, oftentimes it is recommended to use tick prevention all year long because ticks are active anywhere, anytime the weather is above 1 degree Celsius, even if there is snow on the ground. So just being aware of that. Up further in northern Ontario, oftentimes the recommendation is 9 months. So basically whenever the temperature comes kind of above that 1 degree Celsius and right through until it goes below that in the winter. So the main months you're usually not using it is, the dead of winter, usually December, January, February, kind of around that time. If you are traveling south, so a lot of our locals will go down and we consider them the snowbirds, that they go down to somewhere south in the winter time. If you're going south, a lot of the southern states has heartworm all year long because it is such a warm climate. So just keeping that in mind, and if you are traveling down to the States, realistically using that tick, heartworm, and flea prevention all year long is really the recommendation for you. Moving on to ticks. There are multiple different types of ticks in Ontario and throughout all of the states as well. The main tick that we have concern with here in Ontario is the black-legged tick or the deer tick. So that tick, our primary concern with it is that it does transmit Lyme disease. Lyme disease in dogs, it can certainly cause problems. It can cause joint pain, and it can also cause issues with the kidneys as well. So we want to be very cautious with that. The main way to know if your dog's been bitten by a tick is finding a tick attached to your dog. So oftentimes they will bite, and start feeding, they go from being a really, really tiny little tick, and I'll show you a picture of what they look like at the beginning, and then multiple days later, so they stay attached oftentimes for up to 5 days, they engorge. They get to be about 5 times the size, and then they will release and fall off. So with ticks, we want to be cautious with removing the tick, that we're not going to leave the head in, because the head is embedded in the skin when it does attach. What I would recommend getting and having in your kit are tick twisters. So tick twisters are like a little tool that we can use to remove the head of the tick from the skin without breaking the head off. If we leave the head in, we can, or if we squish the body or squish the head, we can release the infection, whatever potential infection they're carrying, into the dog. We can also have issues with infection from that actual head being left in there. It does usually take up to 24 hours for that tick to transmit disease. Getting the tick out as quickly as possible is really important. I will show you a video here on how to use the tick twister. Please take note, it's called a tick twister because you need to twist the tool rather than actually pulling like you would with tweezers. If all you have is tweezers, what you need to do is grip solidly but lightly, and then just gently lift directly up rather than twisting when you're using actual tweezers. These tools are much safer. I find it's much less likely that you're going to actually remove the head. Oftentimes people will bring ticks in and say, can you identify this tick for me? I want to know if it has Lyme disease. So even if we have the tick as a specimen, if we send it off to the lab and have it tested, that still doesn't tell us whether that disease has been transmitted to the dog or not. So what we oftentimes will do is have the owner test the dog 6 weeks after being bit by the tick to see if any disease has been transmitted. Doing a test such as a 4DX test or an Acuplex test, test for 3 different tick-borne disease as well as heartworm disease. So it's certainly a good test to get done after you know that tick has bitten your ankle. The diseases it tests for are heartworm, anaplasma, Ehrlichia, and Lyme disease. So moving on to fleas, as we talked about before, using your monthly prevention also covers our flea prevention. The main thing is if you do end up getting a flea infestation, which we call it an infestation because there's not just one flea, there's lots of fleas. This can happen in our dogs, in our cats, and in our household in general. So when a pet gets fleas, the fleas replicate quite quickly. They take a blood meal from the dog, they lay eggs into the environment. So number one, we want to keep them on that prevention to avoid that from happening. But if we do get a flea infestation, what we have to remember is we need to treat every animal in the house. Even if it's just an indoors only kitty, those fleas will jump off your dog onto your cat as soon as you put the prevention or the treatment on your dog. So we need to treat every single animal in the house for 3 months in total. So treat, in a month's time treat again, in a month's time treat again. This will kill the whole flea cycle. Ideally, we want to use a medication that has not only an adulticide, which kills the adult fleas, but also has an insect growth regulator, which makes the immature pupae form of the flea not come to maturity. So they're not going to continue to produce those eggs. And with that, realistically, all of the eggs that have been laid when your dog first got the infection are in the environment. So the places oftentimes they like to rest on their bed, on your bed, depending on where they sleep, is where all the eggs will be. So we want to wash really well, all of the bedding, all of the dog beds, the couch, wherever you think that they're going to be laying and resting. You want to do a hot water laundry cycle, and you also want to vacuum everything and throw out your vacuum bag or empty out your vacuum canister really well. The other thing that we're concerned with fleas is they do actually carry their own little parasite that comes with them, which is actually one of our most common parasites we see in dogs and cats, which is a tapeworm called Toxocara. So that tapeworm, you can oftentimes see little rice-like particles around the bum of your dog or your cat. Those are little tapeworm segments. And when tapeworms are there, we often suspect that fleas are there as well. A lot of people think, oh, if my dog has fleas, it'll be really obvious, they'll be super itchy. That's not always the case. Oftentimes, yes, dogs are itchy or cats are itchy with it, and especially if they have a flea allergy sensitivity, they would be very itchy. But especially with cats, we don't often see the live fleas because they are such fastidious groomers that they are licking those fleas off and actually consuming them, which is how they get the tapeworms. With our dogs, it's a little bit different. They don't do as much grooming, but we do have our thicker, denser coats. Sometimes if you look on their belly, you can see a live flea moving very quickly. However, what we oftentimes will look for, rather than actual fleas, is flea dirt. So what flea dirt is it's the poop that the fleas make. So when the fleas poop, they have little black, looks like little pieces of dirt. The place that I see it the very most in most dogs and animals, and you will notice they're quite itchy on this area just above the tail, is if you take a fine tooth comb and you comb it through that area, sometimes you'll see little black specks or like little pieces of pepper. If you can rub some of that pepper off, get a white paper towel and wet it. Wipe up that dirt onto that paper towel. If that black dirt turns red or like a rust color, that's flea dirt. That's the blood that's being digested, and that's why it turns red. So if your dog has flea dirt or your cat has flea dirt, your pet has fleas and your house is now infested with fleas. So please follow our guidelines, treating 3 times, once a month for 3 treatments for every animal in the house, and you should be able to get rid of that infestation. Those little eggs can stay in the environment for a very long time, so there's a possibility you could move into a house that has fleas. So don't feel like, it's not something that's going to happen to you. It certainly can. Just taking the precautions and using your prevention, and you can avoid it altogether. Okay, moving on to mosquitoes. Those pesky mosquitoes, we all hate them. They're buzzing around your ear, biting you, making you itchy. They do the same thing to dogs, except for dogs. I mean, with people, mosquitoes can carry lots of different diseases like malaria. Thankfully, in Ontario, we don't have that disease here, but the mosquitoes do carry a disease called heartworm, which our dogs and cats can both get from these mosquitoes. Not all mosquitoes carry heartworm, but certainly there is always a risk. The southern states, where it's nice and hot all year long, they have an overrepresentation of heartworm disease down there. So take extra caution if you're traveling down to the southern states, especially if you're going down for half a year, you're vacationing there. Please keep your pet on heartworm prevention. The main thing that we're seeing here in Ontario is those numbers of heartworm disease are actually increasing. It's mostly from imported pets, so a lot of pets coming up from the States, but it's also from people traveling down to the States. bringing their dogs back, and they're actually bringing heartworm back with them. So the more number of heartworm cases that we see in Ontario, the more that we will get if we're not using heartworm prevention. So as it sounds, heartworm is actually a parasitic worm that lives in the heart of dogs and cats. The mosquito, they actually inject microfilaria, or like an infant stage of that worm. When they mature, they end up camping out in the heart of the dog or the cat, sometimes just one, sometimes multiple. And what happens is those worms can cause blockages, and oftentimes what we'll see is the dog has a hard time breathing because the blood flow to those pulmonary vessels is not great. Getting an annual heartworm test, screening test done is very important. So getting tested for heartworm, making sure they don't have it at the beginning of the heartworm season, and then getting your dog on prevention for June to November, so 6 months a year if you're going to be just living up here in Canada, or full all year long if you're going to be traveling down to the southern states in the winter time. Heartworm disease is extremely difficult to treat. It takes a very long process of multiple different medications, and it can potentially be fatal if we're treating them, because obviously we're trying to kill a worm that's living in our dog's heart. So we have to be very careful in doing that. We have to monitor them closely during their treatment phase. So realistically, the prevention of heartworm is much easier than the treatment of heartworm. You also have to consider the cost of treatment. The cost of treatment is much, much more expensive than the cost of prevention. So please, if you have a dog, keeping them on heartworm prevention is so, so important. Even if the numbers of heartworm are not nearly as high here as they are in the States, they are on the rise, and we do see multiple cases per year at every clinic in our area. Last thing that we're going to talk about is black flies. So black flies aren't particularly bad, I guess you could say, for our dogs, as they don't carry any nasty diseases like the 3 previous ones that we've spoken about. However, they do leave a pretty nasty mark, and we do get dogs in every summer with black fly bites that the owners are, have a big question mark saying, what the heck's happening to my dog? So oftentimes we'll see those black fly bites on the minimally haired areas, so especially along the belly. And they look almost like a big ring, and pretty substantial. They certainly can be itchy. With black, and as I mentioned before, some of our spot-on products do have some insect repellent properties. So talking to your vet clinic and seeing which type of prevention is most suitable to your specific pet. And if they do get covered in those bugs, realistically what I do before you head out camping is contact your veterinarian, get them to give you a dose of Benadryl, and have some Benadryl on hand for your trip, just in case you get a nasty bee sting, you get some black fly bites that are quite itchy. That will certainly give your dog some relief from that kind of itch factor. Thanks so much for joining us today. Please feel free to check out our Instagram page for daily tips and tricks. Our biggest compliment is if you share with a friend either our video or our Instagram page. We'd love to have everyone as informed as possible to keep our pets living longer, happier, healthier lives together with us. So thanks so much for your time, and we'll be back next week with another episode on heat stroke in dogs. Thanks, guys. Take care.